During the COVID-19 pandemic that we're going through, a lot of people forget that there was and still is the overdoses that are occurring in the US. So I wanted to also present this as just a little piece of information. Maybe it means something, maybe it doesn't, but I thought it was interesting. So I wanted to present it. So this article comes from Gizmodo. It's talking about the drug overdoses that occurred last year were very, very high. Even though the COVID-19 pandemic is going on, it's not the only public health crisis that's going on. Or, we got these criminal drug addicts out here, as I like to call them. Shout out to Torian Rain Reloaded for all of his content on these quote deaths of despair and all these fentanyl, Phoebes out here. Anyway, the US is currently dealing with a lot of different things, not only the many black swans that we have going on at one time, and the economy being affected, politics, we're in an election year and all that. But they said like last year, the end of 2019, there were nearly 71,000 deaths attributed to drug overdose, according to the CDC, the highest yearly number to date. And it's looking like this year will be even worse because I asked this question at the beginning of the pandemic. This was back here in the US. This was back around February. And I was asking, okay, what's going to happen with a lot of these drug addicts out here? Because we got a lot of drug addicts and they're not, if they're on drugs, if they get infected, how is that going to affect people who are not on drugs, and how does that affect their families? You're adding, fuel to the fire. But here we go. So the figures come from a provisional count of mortality data collected from all states and territories and analyzed by the CDC. So you can click on this link right here in blue, the provisional count, and that'll give you the mortality data for these areas. The CDC tried to account for gaps in the data, such as reporting delays, but it's possible that the exact numbers may change by the time a final analysis is published. Still, the provisional data now covers all 12 months of 2019 and is unlikely to change significantly between now and the final report. So the final report probably won't come out until the fall sometimes because they've had a lot of delays. The reporting delays, of course, will occur because we were shut down and remain shut down in certain areas, especially with the CDC. I know they've been very busy, so obviously there will be delays. However, when they say that the numbers are unlikely to change significantly, that's true. I don't think they're going to change, meaning that they're going to blow up. Like the numbers are not going to just, absolutely just go way up, but they will go up, in my opinion, by the time the final report comes out. They're not going to just stay the same because you're looking at different age groups, you're looking at different socioeconomic backgrounds, different areas that they're living in, and so forth. And things have changed. Living arrangements have definitely changed for people since the pandemic has started. So there were 70,980 deaths related to drug overdose, slightly above 70,237 deaths officially recorded in 2017, currently the high water mark. As with previous years, a majority of these deaths involved opioid, Olivia, with synthetic opioids like fentanyl linked to some 36,000 deaths. It's worth noting that overdose deaths sometimes involve more than one drug. I'm glad they said that because you have fentanyl, carfentanil, you got, heroin out here, you got, they be taking all kinds of stuff. And so, yes, it does a lot of times involve more than one drug. This is why when people were doing videos about Narcan was not working or it was delayed in giving the response that it's supposed to give. Narcan is supposed to reverse an overdose. And sometimes that was not effective. Sometimes they had to use a higher dose of Narcan or 2 doses at a time for a druggie a junkie. I'm gonna say it what it is, because people like to say, "Oh, they're patients." No, you're a drunkie. You're a druggie. You're a junkie. You're on the street, and we've seen the videos of the overdose on the street with the cops and with other people pouring milk on them and stuff. I don't know what that's gonna do, but in my opinion, if you're overdosing, pouring milk or any kind of liquid, the person could probably drown. But if they think that helps, I guess, I don't know nothing about that anyway. Moving on. So 2018 saw a slight decline in overdose deaths down to around 68,000. That's still a lot of people dead. That raised the hopes that the situation overall was starting to improve. They're always looking for the silver lining. They didn't do all this silver lining searching and looking and hoping and wishing and praying when we had, when we had the crack epidemic, and that was affecting Black people primarily in this country. All this wishing, hoping, praying, and singing and dancing, all this hoping for a better tomorrow, that did not come during the crack epidemic. I'm just going to put that out there. But now, of course, since the palm colored people are affected primarily, you see there's a change in the way they say things. So they are talking about the gains that they thought were going to occur may have been illusory. They may have been, they may have been having a fever dream. I hope things get better, and they ain't got better. So, according to the Drug Policy Alliance, a nonprofit organization that advocates for the greater use of harm reduction methods in drug policies, it's likely that 2020 won't be any better, given the far reaching effects of the pandemic so far. And this is what I was thinking too. They said, quote, while the increase in overdose deaths in the US in 2019 is devastating, it is not at all surprising. And there is reason to believe that these deaths will continue to climb in 2020 as a result of the COVID-19 pandemic, which has increased isolation, disrupted the drug supply. That's a big one right there. We've been hearing about that in California. Their drug supply is just drying up. And reduced access to harm reduction and treatment support. So they don't have, they can't go to AA meet, or excuse me, not AA, or, well, they probably do AA too. They can't go to their NA meetings, and they can't talk to their counselors. They can't get their, their treatment support. They can't go and do those things. They can't, some of them can't even go to the regular physicians that they go to get help. So this is why you're seeing a potential increase in the numbers throughout 2020. You also have people that have lost their jobs. You have people that are working addicts that work, but they're addicted to drugs, and they're able to hide it well and compartmentalize that. They have their work life, their family life, their drug life. There's people who do that. And so that if you lose your job, or you can't go to work and you have to be at home, teleworking, you have to be around your children, that adds more stress to a person who's less likely to cope with it. So I'm looking at the human element of this, because it's not only affecting the palm colored people, it can also affect us as well in the Black community with other substances. I'm hoping it's not going to be fentanyl or anything, but it could be with other substances such as alcohol, marijuana, and so forth. So we have to be careful in, managing our stress. So that's the basic gist for me from this article. You can read the rest of it for yourself. I just wanted to bring this as a piece of information for us to remember that the pandemic is not the only thing going on. There are a lot of other things happening, and I hope that you stay vigilant on managing your stress, talking to someone that you can talk to, finding some way to get that stress out, exercising, going outside. If you have to go out early in the morning, if you can exercise, or late in the evening, find some way to cope with your stress. And always, try to be as safe as possible when outside and inside. Finding a hobby, finding something that you can do that brings you a lot of interest. These people that they're talking about in this article may have tried that, but it didn't work for them. You have to, and I would say the last thing is to, whatever you decide to do to reduce your stress and manage it, be consistent with that. try not to do things alone. Try to have somebody that you could be social, interact with. But on them, yeah, I they had record numbers last year. We might see record numbers this year. So just be aware. Keep your pepper spray because you never know when you come up on one of these people and they on this fentanyl stuff. Protect yourself. All right, y'all. I'll talk to you later. Peace.